Say, Mitch been with the GBI now going on 20 plus years. Good Christian man, does a good job for us. So Mitch, come on up.
Thanks, Sheriff. Two things I want to point out right away about the what we're here to discuss is one, most importantly, you guys don't have a drug problem in White County, North Georgia. I've worked all over the state. In terms of prevalence of drug, this is probably the best area. Well, not probably, it is the best area that I've ever worked in. And as you've heard the sheriff talk about the people that are in jail, that are there for some other charge besides an actual narcotic charge, but they're also abusing narcotics. When you know you've got a drug problem, you've got high violent crime. In other areas of the state that I've worked in, that's generally what you have is high violent crime. You have murders, aggravated assaults, etc. And we're all well blessed here, and I say we because I live in these communities up here as well. We're blessed that we don't have that. Secondly, as I move on, is I recognize, and so does the staff at Appalachian and Sheriff Walden, is that we're not going to arrest our way out of any drug problem, especially not the opioid drug problem. We're just one piece of the pie. And I applaud y'all for bringing this forum here with many different pieces of the pie, and we are just one. And I'll discuss in short our piece of the pie. There's many other areas of the pie that I'm not only not an expert in, but not extremely familiar in. But I do recognize that it's going to take the entire pie to combat this problem. I'm not even going to say resolve this problem. I'm going to say combat this problem. We in Georgia have really only recently started facing the heroin or opioid epidemic. The Northeast, and really what I mean by the Northeast is kind of from Ohio and take a right turn up through New Jersey, New York. Those areas have been devastated with heroin for many years, to the point that it appears they've kind of thrown their hands up and almost given up. So they don't even really have a very good plan. As a matter of fact, next week I'm going to a conference in New Jersey on this very matter. Y'all got to know that's important to me because I don't particularly like airplanes. I'm a homebody. I don't particularly like leaving home, and I'm a small town boy. I definitely don't like going to big cities, and I got to fly to Philadelphia. But I'm going to learn what they've been doing for years and years and years, whereas we're just now starting. So I'll be there next week learning that, but I'll tell you the plan that we have right now to try to stop the bleeding, because that's the way we look at it. Is we're bleeding right now. It's not bad because we're not facing a ton of overdoses every single day like they are in the Northeast, but trust me, it's coming if we don't get a handle on it. And our plan going forward is, well, let me tell you what our plan was in the past. It was in the law enforcement community. Good, bad, or indifferent, this is essentially how we treated an overdose. If someone overdosed and they died in their home, motel, car, etc., then as an investigator, and I did this many times as a GBI agent, we would come to the scene and we would work the scene diligently to make sure that no foul play, being that no one else harmed them, was present. And as long as we didn't see that, then we would document it properly, and then we would pack up and leave, and that would be the end of it. And that's the way we worked overdose cases. We recognize now that we cannot continue to do that, especially not from a drug enforcement perspective. From a drug enforcement perspective, we have to take that further. We have to complete additional interviews, just like we would if it was an actual homicide. Who was the victim last with? Who were they last associated with? Who did they last talk to? Where did the narcotics come that harmed them? Because that's the important part. The important part is we all recognize that heroin is bad. I don't think anyone can argue with that. And And not only is heroin bad, but now we've added something additional to it, and that's fentanyl. Fentanyl is a synthetic heroin. When you start combining heroin and synthetic heroin, fentanyl together, you know you're essentially playing Russian roulette. And that's very dangerous. If I'm a drug dealer and I'm selling heroin that's mixed with fentanyl, and I'm selling it to people, and they're going to come here. I know heroin addicts are going to come buy it from me because that's a better high from them. So they're going to flock to me. So for me as a businessman, so to speak, and look at drug dealers from a business aspect for just a second, then that's going to be the product that I'm going to sell because I'm going to get more customers. Well, how do I value life, knowing that people are probably going to die from that? I don't, but I don't care because I'm making money. Well, from a law enforcement perspective, we view that as those people should not be allowed to be in society, and they should go to prison, because that's the purpose of prisons, is you've shown the capability that you can't function within the laws of prison and the good human nature of society, and you should be removed from society. And so we're targeting these dealers now through these overdoses. Now, some problems that we're facing in our investigations. We've been doing this about 6 months. We've successfully indicted on the federal level one organization. The federal laws are very good for us because you can have heroin, and if heroin resulted in a serious injury, it doesn't even have to result in death. A serious injury, in other words, someone overdosed but then they revived from Narcan, they can be charged with the same law, which carries a sentence of 20 to life in prison, federal prison, which means you're not getting out, pretty much. We've indicted one case that was centered in White County and Habersham County, and then we tracked the original suppliers to Atlanta, and we arrested them as well. So we've got one case right now that's pending, which is kind of our test case. And we've gotten a lot of feedback that the U.S. Attorney's Office out of Atlanta, because they've been pushing this a little bit for a little while in Atlanta. I understand Atlanta's had a much, much bigger problem than we have, just by the nature of being Metro Atlanta, and they've had a heroin problem there for years. So they've reached out to us here recently to continue to provide them with these type of investigations, these type of cases as we resolve them, and we've been working in conjunction with them. And that's gone very well for us. I had a point there and I forgot it.
Take a sip of water, that'll bring it back.
I'd have to walk way away from
Or
it.
you can
I still like talking like this.
or you can just stand up there and look handsome.
Thank you, man.
You have to make eye contact with him.
Sorry. But in short, and I know I'm over my time. In short, that is our plan moving forward to carry our weight, so to speak, for our piece of the pie. Is really target the people who are pushing heroin, selling heroin and fentanyl. Here was the point I wanted to make. It finally came back to me. Fentanyl is so dangerous. It's so much more dangerous. Human nature, and I was no different. Luckily, not necessarily in the drug arena, but I understand human nature. Just like Sheriff Walden said, I'm an adrenaline junkie when it comes to explosive. That's why I do it, because I love the rush. That's what I do. But I understand that people seek enlightenment in many other areas, and when people are down in life, they at times turn to narcotics. That's just kind of human nature. Plus, younger, and this is what really bothers me, the younger generation is more experimental than anybody, just like all of us were. And we all experimented in one form or fashion or another. The problem with fentanyl is they're actually creating counterfeit pills, which look like Xanax, look like oxycodone, but they're actually pure fentanyl. And so you have a teenage boy, a teenage girl who talks his girlfriend into, hey, let's snort some oxycodone tonight, and he goes and buys some, not knowing that what he's actually buying is fentanyl. And then you have a guy who might have done it before talks a young lady into doing it for the first time. She does it. He says, sure, I'll try it one time, just see if I like it. And she dies right there. She dies right there. And that's happening all over the United States because of fentanyl, because of what drug dealers are doing just to make a dollar, just to make a dollar. Never lose sight of that. This is all just to make a dollar. You almost have to look at it in a business sense that for drug dealers, this is just to make a dollar. They don't value these people's life enough. They don't care because they just want the money. That's what bothers me the most about this particular drug. And right now, they're usually putting it in heroin, but what we're seeing more of, and we're seeing it here in North Georgia, is it's coming in the counterfeit pills, and that's what bothers me the most, is young kids, or that's what scares me the most, is young kids who are just experimenting, thinking they're trying one thing, knowing that their friends have done it for many, many times and they've been okay, but they don't know what they really got is a tablet full of fentanyl. That's what bothers me and scares me the most. And that's why here we are working or trying to do our part to combat this issue. Even if it's just bring it to some stability. Even if we can't back it up and bring it down, and we never will. Again, human nature, let's all understand that we'll never get rid of drug use. But if we can keep people from dying, then that's our primary goal. We don't want people dying because they're using drugs. Thank you.
Thank you.